Assessing health data is an aggregate of all health measures for individuals in a community and includes data such as life expectancy, birth and death rates, and mortality from various diseases. General background data consists of components like age, allergies, medical history, habits, socioeconomic status, lifestyles, beliefs, and sensory deficits. Urine output, gastric reflex, and bowel habits are significant only if the disease affecting these functions is present. So in an emergency, ask questions and interview while you're getting vital signs. A registered nurse with necessary knowledge, skills, and ability may collect information pertaining to the patient's health history and perform a physical examination that includes finding out if there are other areas that are a concern to the patient. Remember, nursing is holistic care. It's body, mind, and spirit. So when performing a history and physical exam, the nurse should take a timely report to and consult with other members of the healthcare team and then make referrals as necessary. A registered nurse who is not an advanced practice nurse, when collecting a patient's history and performing a physical examination, should not form a medical diagnosis. The data from a history and physical examination should be recorded as soon after the event as possible. From a legal perspective, if it's not documented, it's not done. Brief notes can be taken during an exam, and when documenting, use short, clear phrases and avoid redundant phrases and descriptions. Now remember, you cannot delegate a general survey to a nursing assisted personnel. Remember, no teaching, no assessment, no judgment can be delegated. The nurse can direct a nursing assistant to obtain vital signs, but remember, not an initial set. Subsequent measurements if the patient is stable. Remember, the nurse does everything, including vital signs, on admissions, discharges, and transfers. Only after they're stable will the nurse then delegate vital signs to be done. The nurse can direct a nursing assistant to report a patient's subjective signs and symptoms. They can measure a patient's height and weight, monitor oral intake and urinary output. Obtaining a patient's health history and performing examinations are activities completed by the nurse during the assessment phase of the nursing process. Assessment, as we previously talked about, is identified as the first step of the nursing process. Information obtained during this phase contributes to the database that identifies a patient's current and past health state, and it gives a baseline against which to measure changes. The purpose of the nursing assessment is to enable the nurse to make a judgment about the patient's health state. However, it is performed continuously throughout the nursing process to validate the diagnosis, evaluate a patient's response to nursing interventions, and determine the extent to which patient outcomes and goals have been met. A medical history is a standard format designed to collect data to be used primarily by the physician to determine risk for disease and diagnose a medical condition. The physician's physical exam, lab, and diagnostic tests assists in establishing that medical diagnosis and evaluate specific medical therapy. The information collected and reported by the physician is also used by the nurses and other healthcare providers, but within their focus and scope of practice. An example, a physician has done a neurological exam and a patient now has an abnormal result, which is a brain lesion. The nurse may use those same results to identify a nursing diagnosis of risk for falls. A physical therapist may also use those same results to plan therapy involving exercise, splints, or ambulatory aids. Functional health patterns. Behaviors are strongly linked to many healthcare problems, and healthcare disparities are due to stereotyping biases and prejudice of healthcare providers, and the nurse can decrease these through staff education. Inclusion of a review of mental status is highly recommended when a nurse performs an examination of an older adult. Allow extra time and be patient. Be relaxed and unhurried with the geriatric population. Do not assume that aging is always accompanied by an illness or a disability. Many older adults are able to adapt to change and maintain functional independence. Provide adequate space for the exam, particularly if the patient uses a mobility aid. So how would you examine a patient with a lung issue? Well, position and patient sitting upright because this promotes full lung expansion during the exam. Patients with chronic respiratory disease will likely need to sit up throughout the examination because of shortness of breath. Only if the patient is unable to tolerate sitting would a supine position or a side-lying position be used. So beginning with the first health perception, health management pattern. This includes information about the patient's ideas about risk factors. This includes healthcare behaviors such as health promotion and illness prevention activities, medical treatments, and follow-up care. Nutritional metabolic. This includes daily consumption of food and fluids. What is the patient's favorite foods? Do they use dietary supplements? Do they need dietary supplements? Does the patient have any skin lesions, an ability to heal, or is there a problem with healing? So looking at the condition of the skin, check their height, weight, their temperature, and a general survey can describe the patient's general nutritional status. Elimination patterns describe the regulation, control, and removal of byproducts and waste in the body. Patterns of bowel and urinary excretion and perceived regularity or irregularity of elimination. Use of laxative and changes in times, modes, quality, or quantity of excretions should be documented. Activity exercise pattern. This is patterns of patient's exercise, activity, leisure, and recreation. ADLs require energy expenditure, and the nurse should identify any factors that interfere with their lifestyle, such as illness or injury. Sleep rest pattern. This is a pattern of sleep and rest or relaxation in a 24-hour period. This also includes perception of the quality and quantity of sleep, rest, and if they use any sleep aids. Cognitive perceptual pattern is adequacy of vision, hearing, touch, smell, pain perception, and management. It also includes language, judgment, memory, and decisions. The role relationship pattern is perception of major roles in their lifestyle relationships and responsibilities in the current situation, whether they're a wife, a mother, a daughter, a husband, a father, a son. And satisfaction with or disturbance in the roles and relationships would follow under role relationship pattern. Sexuality reproductive pattern. This is satisfaction with their sexuality or sexual relationships. This also includes reproductive pattern, like female menstrual and premenopausal history. Coping stress tolerance patterns includes information about other major stressors confronting a patient, the capacity to resist challenges, to self-integrity, methods of handling the stress. Do they have support systems in place? What is their perceived ability to control and manage situations? What kind of coping mechanisms have they used in the past that have worked? And then value belief pattern. The values, goals, or beliefs, including spirituality, that guide choices or decisions should be discussed. Perceived conflicts in values, belief, or expectations could affect their health issues. Now we talked about inspection. Inspection is probably the first part of major techniques. As an experienced nurse learns to make multiple visual examination of body parts or areas almost simultaneously while becoming very perceptive of the abnormalities. Performing a physical examination of the chest uses inspection, palpation, percussion, and auscultation to determine the respiratory status and differentiate primary lung problems from cardiac problems. When assessing the abdomen, auscultation is done before palpation or percussion because palpation and percussion can cause changes in the bowel sounds and then alter the findings. Palpation uses the sense of touch. Percussion involves tapping the body with the fingertips to evaluate the size, the borders, consistency of the body organs, and to discover fluid in body cavities. Auscultation is listening with the stethoscope to sounds produced by the body. To remember how to do the physical exam of the abdomen is what I call in a perfect place, IAPP, inspection, auscultation, percussion, palpation. The dorsum, which is the back of the hand, is more sensitive to temperature variation. The pads of the fingertips detect any subtle changes in texture, shape, size, consistency, and if there are pulses in the body parts. Bimanual palpation involves one hand placed over the other while the pressure is applied. The upper hand exerts downward pressure as the other hand feels for the subtle characteristics of underlying organs and masses. Now, a focused assessment is needed when a patient has clinical symptoms that indicate a problem. The screening examination or assessment is used to assess for possible problems like colorectal cancer in patients who are age 50 or older. An emergency assessment is done when the nurse needs to obtain information about life-threatening problems quickly while simultaneously taking action to maintain vital function. The nurse may need to ask only the most pertinent questions for a specific problem and then obtain more information later. A complete health history will include subjective information that is not available in the healthcare provider's medical history. Family members may be able to provide some subjective data, but only the patient will be able to give subjective information about their shortness of breath. When obtaining an initial health history from a patient who immigrated to the United States several years ago, it is most important for the nurse to first, and the correct answer is C, determine the extent of a patient's identification with the cultural group. The nurse must be sensitive to potential cultural influences like issues of eye contact, space, modesty, and touching. To avoid violating any cultural-based practices, the nurse should ask the patient about cultural identification and practices. The nurse takes a health history and performs a physical examination on a patient admitted to the hospital. The nurse would be most concerned if what occurs. The correct answer is the patient suddenly develops severe shortness of breath. Signs and symptoms of problems that are life-threatening, such as breathing problems, take priority, and an emergency assessment should be performed and life-saving interventions initiated based on those assessment findings. The key is to prioritize. Remember, you could take vital signs and address the problem. Would you medicate first? No, not without having more information.